For many years, doctors have recommended a daily low dose of aspirin to prevent strokes and heart attacks in a variety of patients. Those recommendations have now changed. Should you continue to take aspirin? Stick around to find out. Evidence shows that taking a low dose of aspirin, 75 to 100 milligrams daily, is effective in decreasing the risk of heart attack and stroke in patients who are at an increased risk for diseases of the heart and blood vessels. Age is one of the strongest risk factors for heart attacks and strokes, but age also increases the risk of bleeding from aspirin. Multiple studies show that people who take aspirin on a daily basis are at increased risk of bleeding into the stomach and the intestines, bleeding into the brain, and suffering from strokes caused by bleeding. For daily low-dose aspirin to be beneficial for the prevention of strokes and heart attacks, the benefits of taking aspirin must outweigh the risks of bleeding and other side effects. Because of this delicate balance between risk and benefit, the usefulness of taking aspirin for primary prevention varies significantly from age group to age group. And to complicate matters more, the greater the risk for heart attack and stroke, the greater the benefit of taking low-dose aspirin. Aspirin irreversibly inhibits the cyclooxygenase 1 enzyme, or COX-1 enzyme, which plays an important role in the clotting of blood. The cyclooxygenase enzyme, or COX-1 enzyme, allows certain cells in the blood, known as platelets, to clump together and form a clot. If the clot forms in a narrowed artery, it can cut off the supply of blood to the tissue and lead to a heart attack or a stroke. We can use aspirin either as primary or secondary prevention for heart attacks and strokes. In primary prevention, people who have never had a heart attack or stroke or other signs of heart or blood vessel disease such as blockage of arteries take aspirin to prevent a first heart attack or stroke. In secondary prevention, people who have already had a heart attack or stroke or evidence of other heart or blood vessel disease take aspirin to prevent another heart attack or stroke. The benefits of taking aspirin for secondary prevention are clear-cut and well established. However, the benefits of taking aspirin for primary prevention is not as clear-cut and varies significantly based on heart and blood vessel disease risk, age, and whether there's an increased risk for bleeding, for example, if there are intestinal tract ulcers, smoking, or diabetes. A few studies have highlighted this difference in benefits from patient group to patient group, prompting the U.S. Preventative Services Task Force to update its recommendations on the use of low-dose aspirin for the prevention of heart attacks and strokes. The updated recommendations state that for people between the ages of 40 and 59, who have an increased 10-year risk for heart attack and stroke greater than or equal to 10%, who do not have an increased risk of bleeding, and who are willing to take aspirin on a daily basis to prevent heart attacks and strokes, the decision to start aspirin should be an individual one. The U.S. Preventative Services Task Force determined that aspirin use in this group of patients had a small net benefit. They have concluded that starting low-dose aspirin in patients age 60 and older had no net benefit, and therefore they did not recommend its use for primary prevention in this group. Additionally, the U.S. Preventative Services Task Force concluded that there was not enough evidence to show that low-dose aspirin reduced colorectal cancer incidence and mortality. The task force pointed out that there was a difference between starting aspirin therapy and continuing the use of aspirin at age 60. People who started using aspirin in their 50s because of an increased 10-year risk for heart attack and stroke that was greater than or equal to 10% would likely have more severe disease in their 60s than people who develop heart and blood vessel disease at age 60. Those people would probably benefit more than people who started taking aspirin in their 60s. Guidelines regarding the use of aspirin vary from organization to organization. The European Society of Cardiology's 2016 conclusion on primary prevention was that antiplatelet therapy, that is aspirin therapy, was not indicated in individuals who were free of cardiovascular disease due to the increased risk of major bleeding. The American College of Cardiology stated in its practice guidelines in 2019 that low-dose aspirin should not be used routinely for primary prevention of heart attacks and strokes in adults over the age of 70. The American Diabetes Association stated that for patients over the age of 70 with or without diabetes, aspirin use had greater risks than benefits and therefore was not recommended in these patients. The benefits of taking aspirin for secondary prevention of heart attacks and strokes are undisputable. Whether you should take daily low-dose aspirin depends on your age, your history of heart disease, your risk for having a future heart attack or stroke, your risk for bleeding or aspirin allergies, and should be discussed with your doctor. If you want to know what your 10-year risk for heart disease or stroke is, I've included a link for the ACC/AHA online 10-year CVD risk calculator in the description below. I hope you found the video useful. If you did, like, share, and subscribe to the channel so that we can continue to bring you useful updates on current topics in medicine. Thanks for watching.